I'm Dr. Johann Christopher, consultant cardiologist at the Care Hospitals, Hyderabad. And today I'm going to talk about cardiac MRI as a tool to evaluate patients with heart failure. We know that heart failure is a clinical syndrome. It is a complex clinical syndrome because the etiology is very varied and it has a very high mortality of up to 50% over a 5-year period, which is more than most of the malignancies. Now, to detect heart failure is a clinical syndrome. However, because of our gradually weakening clinical skills, it is important to augment clinical history and examination by other tools such as the ECG, 2D echo, and advanced modalities. Now, after the initial diagnosis is made, the cardiac MRI adds a layer of security, adds a layer of reassurance. When we evaluate these patients, it integrates all the information which is there clinically, ECG and echo, and puts it on a platform that becomes easy to characterize these patients. Cardiac MRI is a non-invasive investigation. Cardiac MRI is a radiation-free investigation. And if you look at the data available from India, we have about 400 centers all across the country which are capable of doing cardiac MRI. Each cardiac MRI takes about 30 to 40 minutes to complete. And the gadolinium which is used for the scar characterization is freely available in the country and does not need an expensive process to manufacture or import like FDG is required in the PET scan. Cardiac MRI also is a fairly safe technique, and provided the patient is stable, is a very accurate way to characterize the disease. Now, in coronary artery disease, the main role is to evaluate the presence or absence of CAD by a stress perfusion scan, and also to look for viability by a rest gadolinium scan. And the presence of scar more than 50% puts these patients at a very high risk of mortality and also puts them on a stage where medical therapy may be beneficial than surgical or interventional therapy. In valvular heart disease, the CMR is an equivalent test to echo and aids in the difficult to visualize patients, especially indeterminate mitral regurgitation, indeterminate aortic regurgitation, and helps in the timing of surgery. It also helps in the evaluation of difficult to evaluate aortic valves which are calcific, where there is a disagreement between the clinical and the echo picture for the severity of aortic stenosis. But the big advantage of MRI here is in right-sided lesions, the pulmonary valve and the tricuspid valve, where the quantification becomes very, very easy. The pulmonary and aortic quantification is straightforward. We put a VEC image just above the aortic and the pulmonary valve, and we look at the forward flow and the regurgitant flow, and then we measure the regurgitant fraction. In the mitral and tricuspid positions, a little more difficult, wherein we subtract the aortic and the pulmonary flow from the LV and the RV stroke volume respectively, and you get the regurgitant fraction. And this is done in a very mechanical and an easy manner. It does not involve any other kind of angle or a difficult kind of algorithm like is there in the echocardiogram. But the big strength of MRI actually is in the evaluation of non-ischemic cardiomyopathy, where we have a host of diseases and each disease has a different trajectory, has a different kind of a survival curve. So the first disease that is very useful is hypertrophic cardiomyopathy, where we get the scar burden, and above 15% scar, there's a very high chance of sudden cardiac death, and therefore the ICD is a well-recommended investigation and management tool in these patients. In ARVD, it characterizes the disease, it helps you identify the scar, the fat infiltration, and also gives you the RV volumes and the ejection fraction accurately, and helps in the diagnosis, the prognosis, and finally helps in the establishment of ICD as a definitive treatment in these patients. Sarcoid is another disease, especially cardiac sarcoid, wherein the three features, that is a mediastinal lymphadenopathy, a midline septal scar, and a basal inferior septum thinning, are the characteristics of sarcoid. But what is more important is the presence of gadolinium puts these patients of sarcoid at very high risk of sudden cardiac death, and therefore these are patients who will benefit again with an ICD. Amyloidosis is a very difficult disease. It has different manifestations, but the cardiac MRI is like a histological diagnosis. It gives the phenotypic variety of amyloidosis, where you have the biatrial dilatation and the normal sized and thick ventricles. But what is more important is the amyloid kinetics of gadolinium is different, and we have a subendocardial global scar which is very, very typical of amyloid and serves almost as a histological diagnosis of amyloid. What is more important is the presence of the T1 values and also the presence of the ECV at the outset helps determine which way these patients are going to go. And a higher T1 value and a higher ECV value puts these patients at very, very high risk. And the third important aspect here is that once you start the drugs for amyloidosis, which is now available in our country from Pfizer, you will find that the whole amount of gadolinium starts regressing, and these patients start getting better, the atria get better, the ventricles get better, and the gadolinium starts fading away. And so this is a very good tool to assess the progression of these diseases. In patients who have cardiac masses, again, cardiac MRI is a very, very useful tool and helps to characterize the mass, helps to tell us whether it's benign or malignant, and comes to a very, very close histological diagnosis before you can send these patients for a definitive biopsy or for a definitive surgery, and helps in the risk stratification of these patients. Overall, cardiac MRI is a very, very usable tool. It helps in the risk factorization of patients with cardiac disease. It's freely available now. It comes at a very attractive, cost-effective price and should be used by all major cardiac centers in the evaluation of cardiac disease. Thank you very much.